Hello, Mr. Smith.
Hello, sir. How are you?
Doing pretty good. My name is Brandon Kaminsky. I've read your charts and I understand you're here to talk about your COPD.
Yeah, it's giving me a little bit of issue.
Okay. Do you find yourself short of breath during exercise and stuff like that? Or when you're up and walking around a lot?
Yeah, sometimes I'll get, like you said, a short of breath or heaviness in the chest.
Yeah. Okay. Well, I'll just go ahead and say something like some tips to help you manage it in your normal daily life, and then
Hmm.
I'll also discuss some of the medications that your doctor has prescribed for you.
Okay.
The first question I do want to ask you is, are you still smoking?
Yeah, so I still smoke about 2 cigarettes a day. I'm kind of weaning off
Yeah, okay.
from a pack a day.
What did you were a pack a day?
Hmm.
Oh, okay. And about how long did you smoke that for?
Pack a day?
Yeah.
About 5 years or so.
Okay. So not too long, but it's
Did a little damage.
still did a little damage. Okay. Well, it's good that you're weaning off. It's very good progress. Getting it down to 2 cigarettes a day, that you're almost completely done. Um, are you interested in completely stopping smoking altogether?
Eventually, yes, that is the goal.
Okay, yeah, because with COPD, one of the main things that exacerbates it is if you continue to smoke, it's going to continue to do damage to your lungs, and that's the main contributing factor to COPD.
Gotcha. Okay.
Yeah. So there are a few different like replacement options, which since you're only on 2 cigarettes a day, you won't need to use the big guns or anything. We would just use some of the not as strong. There's gums, patches, lozenges, whichever one you would feel comfortable with.
Hmm.
We can go ahead and get that for you.
Okay. Awesome. It's nice to know that I have options for sure.
Oh yeah, because different people prefer different things. Some people don't like the chew gum and stuff like that, and you just slap a patch on, and be good to go. And the next thing I want to talk to you about is your diet.
Okay.
With COPD, we prefer patients to have a high protein diet and high good fat diet. Not bad. I'm not telling you to go and eat a bunch of potato chips or
Okay,
anything.
that's what I heard at first.
No. And also low carb. So
I'm
just
Italian.
I know, but the main thing is portion control.
Okay.
You can still have what you like. You just might have to have a little less of it and replace some of that with not a bunch of fruit and vegetables, but some fruits and vegetables.
Okay.
That way you'll have a well balanced diet, and that'll also help you have enough energy for the day, and you'll find yourself not being short of breath as much.
Okay. Well, I mean, if small sacrifice to feel better, because that's what brought me in the day. So.
Yes, sir. And the next thing I want to talk to you about is there are there is a type of breathing that can help, or a couple different types of breathing that can help you when you're feeling short of breath.
Okay.
The first is pursed lip breathing, which you pretty much just you'll sit in a chair, you'll breathe in through your nose with your mouth completely closed, and then you'll just purse your lips and let it out, just like that. And that'll help you to breathe a little bit from your diaphragm. But another way to do we'll do the diaphragmatic breathing as well. That'll help you monitor how you're breathing.
Okay.
So what you want to do is whenever you get home, you'll lay in your bed, and you'll put one hand across your chest
Okay.
and one underneath your upper rib cage,
Okay.
and then you'll want to push out your stomach as you're breathing in, and the goal is to not have this hand rise, and instead you want your bottom one to rise.
Okay.
So you'll push out with your stomach as you're breathing in. Well, through your nose. Sorry.
Okay.
And then you'll combine that with the pursed lip breathing.
Oh, I see. I
Yeah, so
see.
it's using your diaphragm compared to your upper respiratory,
Okay.
and that'll help to it'll take less energy for you and make it easier throughout your day. And you can do that laying down and then a few times a day just to practice, and then you can move to your chair and start doing it until that's how you're normally breathing.
Okay, I see. Yeah,
Yeah.
that I could as I started, practicing it, I could see how, I was using my diaphragm instead.
Yes, sir.
So thank you.
You're very welcome. One other thing that's very important is exercise. Do you currently exercise?
Not as much as I should, but
Yeah,
I try to stay in shape.
I can see that. Um, we recommend at least 30 minutes a day. Just mild, moderate. Just get yourself up and walking. Nothing too exerting. We don't want to have you gasping for air or anything. Nothing like that. Just
Okay.
light walks, stuff like that. Just get you moving, get your heart going, heart rate a little up, and good to go.
Okay.
Because it'll just it'll help you not get as short of breath, and your body will get more used to activity, so that when you actually have to do something like lifting or moving or anything like that, it'll require less, and you won't feel as out of breath.
Gotcha. Well, I mean, that would be nice because, it's a little hard sometimes, so I'll definitely start making sure I at least get 30 minutes in a day.
Yeah, that would be great because our main goal here is to just get you feeling better, minimize your symptoms as much as possible, and just make your quality of life better.
Well, thank you. Yeah,
You're
that's
very,
awesome.
you're very welcome. Now, a couple things the two medications I want to go over,
Okay.
your doctor prescribed is the Advair Discus inhaler, and
Okay.
then the Spiriva hand inhaler. Now, we'll start off with the Spiriva. This one's a little different than most inhalers. So, it has a little cap. You would just open up the cap, and there's a center chamber.
Okay.
It comes with a pack of pills. They're capsules. You want to pop out one of the capsules, making sure not to expose any of the other capsules. If they are exposed to air, any of the other ones other than that one, you want to go ahead and throw that out because it's no good.
Gotcha.
And then you'll take one out, put it in the center chamber, and then you'll close it back up. Other than the mouthpiece, you'll leave that off. You'll have it upright. You'll press the button to pierce it. It'll pierce the capsule. And then you'll breathe out all fully. And then you'll breathe in. And you'll want to hold that for 10 seconds. And you'll do that twice
Okay.
for it with that one capsule. You don't replace it. You just making sure all of the medication's out of the capsule and you got everything you need.
Gotcha. Okay.
Yeah. So that's not too bad. Then you just dump the capsule, you're good to go. And
Okay.
I want you to go ahead and repeat that back to me just to make sure that we got everything good.
Okay. So for my Spiriva inhaler,
Yes.
so in this case, what I'm gonna do is so the mouth chamber is gonna be closed because I need to load it with one of the capsules, right?
Yeah.
So when I'm taking the capsule out, I just got to make sure that I don't expose any of the other ones.
Mm-hmm.
So once I get the capsule out, I put it in the main chamber
Mm-hmm.
and close that off, and then I guess it's ready now. So then I'm gonna um, exhale fully.
Well, there's a button that you have to press before you do that. It actually
Okay.
pierces the capsule, making it ready for you.
Okay, so then I would hit the button,
Yes.
and that gets the medicine ready.
And then you can go ahead and proceed with that.
Gotcha. Okay, so then I'm gonna exhale.
You don't have to do
Hold
it.
it 10
Hold it 10
seconds.
seconds.
And then I cleared a second time to
Yes,
make
sir.
sure all the medicine's out.
Yeah, you just repeat that same the same Well, the last part, the breathing in.
Okay, and then do I need to do anything to clear the chamber for next time?
For next time, I mean, you would just dump the capsule and you're good to go.
Oh, okay.
Open up the center chamber, clear it, good to go.
Okay, easy peasy.
Yeah, and that one you just do once a day, and then you're done. That's it.
Once a day,
Just
anytime?
once a day.
Okay, perfect.
And then the next one we'll talk about is the Advair discus inhaler. Now this one, it's looks like a little. It's just a purple disc. You grab it with your left hand,
Okay,
and then you open it up with your right thumb, and it'll expose the mouthpiece and a little lever.
okay,
You'll push the lever forward, and then that will prepare your dose. You want to make sure not to tip it or anything like that. You want to leave it completely flat like this,
okay.
and then you'll do the same thing. You'll breathe out, and then breathe in, hold for 10 seconds, then you're good to go.
Okay, so that one's pretty easy. So it's I'm gonna have my Advair.
Yes.
So I'm gonna make sure I hold it with my left hand. Then I'm gonna open the mouthpiece and the valve.
Mhm.
And then just make sure I don't tip it. And then I'm gonna go ahead and just like how I did, do the exhale.
You didn't like you open it up, and then there's a lever in there you got to push to
Right.
grab it.
So
Okay.
so reveal the mouthpiece and then
Yeah.
do the lever, right?
Yeah.
Okay.
I just want to make sure.
Yeah, no, thank you, because this is all new to me. So,
Yes, sir.
and then I do the same thing. I exhale,
Mhm.
clear it twice.
This one you don't have to clear it twice. You
Okay.
just have to do it once.
Oh, okay. So
Yeah.
just one time.
Even easier.
Okay, awesome. Well, yeah, no, I think I got it. That's you explained it really well. So thank you very much.
You're very welcome. Now, there's just a couple other things with that one I want to go over.
Okay.
In the top right, there is the dosage counter to indicate how many doses are left.
Mm-hmm.
When you get down to 5, it'll turn red. That's normal. It's just telling you need to get a backup. It's that time.
Okay.
And that one you'll do twice a day. You want to make sure to separate it by 12 hours. And you want to make sure to rinse it. This one has a steroid in it. So you want to make sure to rinse out your mouth with water, not swallowing it. You spit it out
Okay.
after you use it every time, because that'll prevent thrush from building up in there and similar things like that.
Okay. So just make sure that I rinse my mouth out, spit it out though, the
Yes.
water. Gotcha.
Yeah, every time you use it.
Okay. And then I've got the counter on there, which tells me all my uses, and don't be scared if it goes red, just give a new one.
Yep.
Okay, gotcha.
All right. Well, it sounds like you've just about got it, and we're gonna go ahead and we'll meet back up here in 30 days, see how your medication's working out for you, and go over any issues or any side effects or anything that you've experienced. And I look forward to seeing you then.
Well, thank you, sir. Thank you very much. I appreciate it.
Thank you very much for your time. You have a wonderful day.
You too, sir. Thank you.
Thank you.